Brenda Holloway, what are the ingredients for Ozempic or any GLP-1 like semaglutide for weight loss? Uh, the ingredient is the semaglutide. For the other one, Mounjaro, is tirzepatide. Both of them are glucagon-like peptides, which mimic gut hormones that either make you feel hungry or make you not feel hungry. So these block that, and so the GLP-1 blocks those receptors and makes gives your body a sense of satiety. You feel full. You're not hungry. You don't eat. If you try to eat, you can eat something, but if you eat excessively, you will start to get nauseated. If you continue to eat, you will vomit. So that is a great thing about these treatments for weight loss. They are incredibly effective. They are the most amazing breakthrough in medicine in my 30 plus years of medical practice. There has never been anything like this because one, its primary function is controlling your blood sugar and treating diabetes. So the side effect is weight loss. And so when they first developed these products, they would tell people, oh, you'll lose 7 pounds. Well, people were losing 70 pounds. And people that needed to lose 70 pounds. So the weight loss is kind of directly proportional to the need of weight loss. However much you need to lose, you probably can lose. These products are being compared to gastric bypass. So this is the gastric bypass like benefit without having to have surgery and recuperating from surgery and having the complications from having a gastric bypass that most people have when they've had that procedure, because it reroutes your plumbing, changes the way your body digests food, and it's very difficult to adjust to that. Most people that have that end up what's called the dumping syndrome. So, and it's exactly what it sounds like. Ozempic, Mounjaro, both great products. Semaglutide, tirzepatide, both work. Tirzepatide works on 2 receptors. Ozempic works on 1 receptor. That is why the Mounjaro works better. They both work amazingly well. So I don't wonder if one is a 10, the other one is a 9. So they both work wonderfully. And so usually the decision of which one to take is more based on coverage and whether insurance will cover it or not. The price for these medications is ridiculously high, $1,600 to $1,800 for a 1-month supply. There are versions that are available in various places for as little as $4.99. Sometimes I see it on the internet for less than that. I oftentimes are concerned about what you're actually getting when I see internet. So I do not recommend that anyone gets it from an internet supplier. I do recommend that you get it from a place that you can go to and get it. And there are lots of places that offer this now. Virtually most weight loss facilities offer these products or generic versions of them. And so, but the point is you can go and there's somebody who's monitoring you to make sure if you have any problems or side effects. Again, the side effects are mostly nausea because you're not eating. When you don't eat, your stomach has what's called delayed gastric emptying, so you feel full, but your stomach doesn't really have anything in it. You just feel that way. So you get increased acid in your stomach. That acid doesn't go out of your stomach, so it makes you nauseated. So one of the things I recommend for any of the patients that are using those types of products is to eat some yogurt, coat your stomach. It's the perfect coating because not only do you get the benefits of the probiotics, but it coats your stomach so it protects it from that acid so you don't get the nausea. And so then also you start low and go slow. There's a low dose for a reason to get your body used to the product. And then you titrate up on a monthly basis. Every month you increase the dose until you're at the maximum tolerated dose where you're getting all the benefits, you're losing the weight, and you're not having any significant or subtle side effects. The prices on a couple of the products are less expensive for the starter doses, and then the prices go up on the therapeutic doses, the doses that you're going to have to stay on to lose the weight. So it's very important that you notice that. So if you say, oh, I got a good deal, I got this for $3.99, you'll get it for $3.99 per month. But then after that, it's $4.99, $5.99, $6.99. Now they have you, and you don't want to come off of it because it's working for you. There's nothing about this that is a real negative. If you've seen anybody in the media, if you've seen anybody on television, anybody in the movies that have lost a significant amount of weight, they're on this medication. It's working for them. If you look at Stephen A., if you look at Shaquille O'Neal, if you look at Oprah Winfrey, you look at Gayle King, you look at, for those that like Sports Center, Big Perk. Big Perk looks amazing. And of course, I'm 100% sure that he's taking these medications. I can't recall whether he said that he is or not, but I can state unequivocally that I'm sure that he is. He looks amazing, and most people do. Weight loss makes you more attractive, and you benefit from virtually every other disease state. It decreases your incidence of heart attacks, decreases your incidence of strokes. You look better, you feel better, you move better, so you become more active. Now that you don't have a belly to look over and around, your love life enhances exponentially. Women look good and feel good about themselves, so they feel sexy, so they want more sex. Men, they have the energy now to have sex as they age that they didn't have before, because for every 5 pounds of fat that you have on your body, it takes almost 1 mile of capillary blood flow to supply food and energy to those fat cells. That's a long distance that you no longer have to go through. You drop 10 pounds. Now it's 2 miles that blood doesn't have to travel around your body. So you got all that 2 miles worth of energy that you were not using on other things. Now you got it. So there we go. Okay, Brenda, great question.